Hello, everyone, and welcome back to another episode of Vital Conversations brought to you by MedEdge MEA and MedXBay. Today, I have with me the very talented and very amazing Dr. Mazin Gadir, who has over 19 years of expertise in healthcare innovation, as well as digital transformation. He has held pivotal roles with companies such as IQVIA, Dubai Health Authority, PwC Middle East, and has led various projects and amazing transformational initiatives across digital health in not only the GCC regions, but the UK and KSA as well. He has a background in e-health compliance, health information systems, and organizational development. And the reason why I wanted to make sure that I give you all of this background is because we're having a very great, interesting topic today, which is AI in healthcare. And unless you've been living under a rock, you know that AI in healthcare has been everywhere like the last 3 years, but definitely the last year. We've seen a huge spike in it. And Dr. Gadir is an amazing source of information with direct experience in this field. So I am so honored to have him on this podcast. Thank you so much for joining us, Dr. Gadir.
Thank you, Yunche. It's a pleasure, and I'm much appreciated as well. So thank you for having me.
Absolutely. So let's jump right into it because I have a lot of questions for you. First of them being because this is a podcast, obviously, for healthcare providers in the community at large. Let's just frame what AI is in the aspects of healthcare today. Kind of like where are we as far as the foundation of that?
Um, so I think AI in healthcare is the trend. So this is the most recent trend that hit the markets across the globe, right? The healthcare ecosystems and economies across the globe. It took us obviously by a huge storm, and I believe it was the natural progression. So if you look at the last 15 to 20 years, specifically in our region, the journey began with digitizing hospitals, and the public sector took a lead on it. Then the digitization journey of hospitals required a lot of IT technologies to be implemented, hospital information systems and whatnot, led by three major countries, UAE, Saudi, and Qatar across the Middle East. I think, and they tried to catch up with the rest of the world where people started digitizing hospitals way before. But then when the public sector took a leading position in digitizing hospitals, they found out that obviously the private sector needs to catch up. And when a lot of the public sector groups in healthcare started finding out that now that we've completely connected all our public sector hospitals, what next? The next phase was the health information exchange, which means connecting the private sector with the public sector. But wait a minute, the private sector is still left behind. So now the private sector is catching up. And hence, because of the requirements for connecting the health information exchange and exchanging data between private and public sector. Don't forget, initially, they started also for the digitization of claims and whatnot. And that created a lot of data from the claims that always began earlier than the clinical data exchange, because claims data is connected with money, and everything that has a money stamp on it takes a priority. Right?
Yes.
But unlocked a lot of data, and data kept accumulating year upon year, from which then people started to think about what to do with this. And then COVID hits. COVID has showed us the importance of digitizing and moving into digital solutions, the advent of telemedicine, the need of e-prescription, the need of, where consumer behaviors and consumer confidence and consumer kind of need became so much evident into bringing digital solutions in healthcare, and hence opening up the door for more data to be accumulated. So post-COVID comes the need for, okay, what are we going to do with so much data? first of all, do we have enough data that we need to we can use for research, for reporting and whatnot? Is it clean enough? Does it need more quality measures to actually have better data? Where AI has brought us now to the fact that, okay, we can do a lot with data, but we need to make sure that data is there. So the advent of AI as a trend has hit us in healthcare as we progress from these phases, digitizing public sector, then building the health information exchange to bring in the private sector, and meanwhile also digitizing your claims processing. So it's a lot of data that has been accumulated. Do we need to what do we need to do with this data, and how can we use this data? That's when the AI took us by a storm in the last few years as well, to show us that this tool needs to be utilized to make sense out of the data. But wait a minute, is the data clean enough, good enough to be utilized? Do we have the talent in healthcare to build AI models? Plus, if you have an industry that has been growing in the region by bringing talent and building more infrastructure, is this industry mature enough, has enough depth into it to bring in the AI tools? Do we have enough research, R&D capabilities within the healthcare industry? Are we also utilizing pharma life sciences capabilities to drive this depth of the industry, to try and bring the strength of AI tools on top of the data that was accumulated? So AI has become a trend and a way of looking at the maturity of the healthcare industry as we grow into the next phase of maturity.
Absolutely. I mean, that was I love that you took us on that journey because it really helps to understand the foundational aspects of this and what kind of exacerbated the problem. COVID really catapulted a lot of things for digital across the world, but I think especially in healthcare and conversations that I've had with doctors and various healthcare providers is that the impact of COVID really didn't go away. It kind of just continued to strain the resources and the systems. And now AI was just another thing added to it for problems that they couldn't solve. And now it's like, hey, integrate AI. And they're like, how? So let's talk about that a little bit because while we have all of these amazing ideas and things of what AI can solve, there's a different reality that's happening on the ground in the emergency rooms, in the clinics, the day-to-day work environment. When we're talking about AI, what is the actual real life application for hospitals, clinics, medical centers today?
Sure, I think we can start with the small, low-hanging fruits, the quick wins, right? So AI is powerful to consume data and be supportive in the area of triaging and channeling patients into the right specialty or the right levels of criticality or the right support that is required for that patient or that case, right? So by having AI tools that help you to triage, that means you're able to best utilize your resources and allocate accordingly. So that's one area, the triaging. A lot of companies started very well, but then obviously due to the funding and the business models that they've actually brought into the markets, it didn't work. Babylon was a great example where they have brought in the idea of consuming data and using some sort of AI algorithm to help in the triaging and the funneling of optimizing resources based on the patient case and where that specialty would come in at to play, for example. I think there is also important use cases for no-shows, outpatients, biggest headache, outpatient clinics, and a lot of money waste in the area of no-shows, where you can bring an AI algorithm, provided the data is quality data and it's data that has been fed in, to try and do predictive AI models on where can you reduce your no-shows in outpatient clinics, where you can then minimize the cost, optimize the resources, and maximize the profitability. Don't forget, the whole region or the whole world has moved from from publicly funded health systems to universal health coverages to insurance-based health systems. And that move has created a lot of use cases in the area of claims processing, fraud, waste, and abuse, upcoding, rejection rates. AI models could play a huge role in reducing rejection rates, maximizing profitability from a provider perspective. From a payer perspective, you also can dive into the fraud, waste, and abuse, and also eliminate upcoding and unnecessary duplicate procedures and orders. So the concept of value-based care, where we are transforming the whole health system into, can benefit from the use of AI models, providing the fact that data is accurate, good quality, to be fed into a model and a program, an AI programming tool that could actually allow you to do machine learning models on it, to do generative AI conversations, and then move the envelope with AI to serve in these use cases. Again, one of the first use cases that I've seen back in 2018 when I was an employee of Dubai Health Authority is using AI models for X-rays, for chest X-rays, specifically to try and pinpoint and speed and accelerate the time for radiologists to try and pinpoint where are the cases where we have TB cases, for example, chest infection and TB cases. So instead of looking at thousands of studies that takes 3 days, 4 days, for example, you are using AI models to filter and only show those cases on the X-rays that would have flags, and focus the time and the effort of your radiologist on these specific cases, cutting review time from 4 days to like a few hours, right? So, I mean, a lot of use cases in that. Diabetes care. There's a lot of retinal scanning capabilities that uses AI algorithm to try and for screening patients for those pre-diabetic potential patients that could be isolated and then looked at in order to provide continuous screening programs and continuous prevention programs for them not to fall into the diabetes care management workflow or pathway. So these are a lot. Obviously, I'm talking about a series for the payers, the providers, the regulators, the amount of capabilities that the regulators could utilize AI modeling with when you look at claims data, or now with the health information exchange, to try and get in more population health management protocols that are enforced by AI. Try to make sure that you also influence the decision support mechanism for physicians to make the right decision using those AI tools that are fed with a lot of the medical literature and medical journals, right?
I couldn't agree with you more. And you've said this a few times, and I think it's probably one of the most important topics, honestly, when it comes to AI, is making sure it has the proper data. But that a lot of times it starts with the ethical analysis, right? Making sure that it's equitable, that it is not including the biases that so often comes with human nature, because the goal for AI is to do our work better in areas so we can focus on the more human experiences. So how do we deal with making sure that from the inception of creating this tool, we are eliminating inherent biases within the data to make sure that it's clean before we even get to some of those other steps?
Sure, and that emphasizes the point that AI is not just a product you buy off the shelf, right? It's not like a Lego box that you buy and then you start putting it together. No, there's a lot of research and trial and error process within it. AI is an actual, ecosystem methodology. The model is the least of your worries, but how the model reacts to the data is where you need to spend time, and that's why the advent of AI trends in the world and the maturity level of healthcare systems are synonyms and are proportionate. So if you have a healthcare system that is only driven by commercial transactions and product off the shelf, AI modeling does not work for for a shallow health system. AI modeling in the AI world would only work when you have a healthcare system that is driven by research, by trial and error, by capabilities to actually spend money on bringing just talent and creating an environment for trial and error. So eliminating biases is not something that you would do if you don't have the talent that allows you to assess the output, the environment that actually does not emphasize only the commercial returns, but they want to also celebrate the research, the ROR, return on research. Because again, driving a healthcare system without the AI models and the AI technology would allow you to build a shallow system where you just commercial transaction products off the shelf, implement, and there you go. But when you talk about AI, now we're going back to basics. You don't build an AI ecosystem or a use case without intervening with research capabilities. Talent requirement at this stage is huge. So you need the right talent. You need to the lab, the lab kind of mindset where you test those algorithms, understand the bias, try to study the bias based on historical data, try to compare that with scientific literature, and then start going back into your AI model and start working with data. Primary use of data might bring in the secondary use of data, synthesis data, and try to actually build your data capabilities to try and get that AI model as accurate as possible, eliminating biasness. And obviously, the regulator job is to build that ecosystem where they have to actually celebrate and recognize those institutions that would allow a safe environment for AI models to be tested and research to be benefiting. So the role of academia. That's why you see, for example, the rise of Mohammed bin Zayed AI University in TII, Technology Innovation Institute in the UAE, where they are now understanding that you build an AI economy in healthcare by bringing academia also to be on the same level, shoulder to shoulder, and allow people to study AI models, the output of it. So again, the product mindset where you actually go from design, testing, rolling out, implementing, and then operationalizing that might be disrupted with the AI models where you actually reiterate the design and testing and validation for research to come in before you actually allow it to graduate as a product from which you can then scale up.
And that requires quite a bit of funding, right? It's when you're talking about that long-term research, it requires that if we're saying all of these amazing things that AI can do, they have to be willing to long-term invest in the research in order for us to get it right. And that value add versus the ROI, like you said, return on research, that is a lot of what we're seeing today as a disconnect that's there when it comes to that.
Absolutely. But that's what distinguishes the Harvards of the world and the Oxfords of the world and the golden triangle of Cambridge, Oxford, and London from the rest of its peers, right? Because when you employ research capabilities, and AI is an important tool for that, that might give you open up new industries of scale, the drug discovery, pharmaceutical and life sciences, let alone the fact that once you build that AI ecosystem, you're going to have to supplement this with more computing power, the use of quantum computers, not for a shallow healthcare industry. It's for a deep, well-engraved healthcare industry. Healthcare is not a quick ROI for a short term. A healthcare industry, you need to put in the infrastructure for a long-term ROR, for capabilities building, for talent graduating, and for research celebrating as you actually build into a long-term industry that feeds into other industries, right?
Absolutely. Absolutely. So with all of this in mind, naturally, there's so many things to consider, but the biggest of them, especially when we're talking about AI in healthcare, is security. And with that being such a critical concern, how does AI ensure compliance with regulations like HIPAA and GDPR, especially when they're handling sensitive patient records?
Absolutely. And that requires us understanding the difference, number one, between HIPAA and GDPR, where you have a very limited, limited in the sense that there's a limited maneuverability regulation, GDPR, very strict, that needs to be reviewed and revised to allow certain leeway for research and utilization of data, preserving the confidentiality and the information security when it comes to healthcare data. But also, how do you actually revolutionize HIPAA and revisit HIPAA to look at the next generation of healthcare and ICT data laws? Right. That's why I love the fact that in the UAE, they started creating regulator sandboxes where regulations are questioned or revised, just like you do when you look at AI models, right? You look at the biasness and whatnot. Regulations need to be treated in similar fashion, where you look at creating sandboxes where regulations need to be revisited, revised, and relaxed in certain instances to actually benefit research in depth when it comes to healthcare industry. So again, I believe that HIPAA and GDPR are amazing frameworks that needs to be studied and executed, but at the same time allow some space for it to be relaxed as well and amended to allow further utilization for AI. As AI becomes an important pillar of research in healthcare, I think the use of data and the handling of data needs to be also revolutionized, where you can allow more anonymization and pseudo identification of data, and allow secondary use of data. The creation of synthesis data might help to tackle hardship regulations that does not allow much maneuverability. But again, I would beg both audience, regulators, and industry researchers to look at how industries like healthcare could be expanded upon by allowing more data handling relaxation, obviously safeguarding it, because as we more dive into AI utilization, we are leaving ourselves open for more cybersecurity attacks, more cybersecurity breaches, and that's why we need to also understand how do we keep that secure as we open up more data utilization use cases. So I believe, yes, cybersecurity will become more paramount as the more utilization of AI in healthcare, but the community of research and regulators need to also come together to try and safeguard this ecosystem. As you use data and you understand more data handling relaxation capabilities, you probably need to think about more measures and more controls for cybersecurity measures, for information security and patient confidentiality capabilities, to allow that field to disrupt, but not to disturb the use of AI in healthcare.
I love that. Disrupt, but not disturb. That's a good one. And I really love the concept of the sandbox from a regulatory standpoint. And I think that, I mean, there could be such a use case in the hospitals that are looking to evolve and transform, but need a safer environment to do so, and take a look at their options that are readily available to them, because that could help in the disrupt but not disturb ethos as well, by having that sandbox to say, we would like to begin exploring what this looks like, but we want to do it in an environment that's not going to stop our day to day, take down our hospital, take down our current systems. Just begin figuring out and invite intriguing minds and things like that. And I really do love that. But what I want to do now is just go down a tier. I'm a doctor who owns my own clinic. I've been hearing about AI. I'm listening to this podcast. I think everything you're saying is amazing. But I want to know, for me, I've got 5, 6 other doctors that are under me that are managing and I'm running this clinic. I would love to figure out how to begin implementing AI today and to automate our processes, just begin figuring out where can we use it. What are some of the first initial steps that someone like that should take?
Sure. So what I've heard, what I've learned in this field is, number one, determine what use case you're trying to tackle. What is the problem that you're trying to solve? Always with problem identification and framing your problem, you'll be able to work backwards and then look at what sort of data do you need for solving this problem. Because again, you might be a paper-based clinic and you have a problem with, for example, no-show. So you might not need to have to pivot to AI at this stage because you still have to digitize your data or move your data into a digital format and then look at the quality of your data and how old the data could actually be uh, could be uh, could be stored in terms of the historical data that you have for getting your algorithm to work around that data, right? So I presume number one, use case identification and problem framing. Number two, I would definitely look at the resources for that use cases. What are the infrastructure pieces that you need for that use case to be transformed using AI tools? In other words, data, talent, and definitely, do you have the actual blessings from the regulation if needed, from a certification perspective or regulation perspective, right? And then number three is try to use start small. I think that's an important aspect. Start with the biggest headache you have and the most mature when it comes to having enough infrastructure for that headache, whether it's by having digital tools, having enough data, having the talent for algorithm to be built, and then give them that lab environment for them to test it out, right? So definitely start simple and look at the outcome long term. These are the three maybe advices is I would definitely I would start with. Um, use case problem framing, talent and data maturity and readiness. Are you AI data ready? And there's a very beautiful publication by Gardner about AI data ready organization or AI ready data organization. How do you actually prepare yourself to be ready for an AI use case, right? And then number three is what would be the long term outcome that you're looking at, despite the fact that you will be begging for a short term gain. But let's be realistic that you would probably need to invest money before you make money.
Right. Right. I love that practical advice, very realistic, and probably answers that if someone has been searching around they hadn't heard before. So that I really, really appreciate that. So we have one final question for you regarding AI as a whole, and that is looking forward, what emerging AI technologies hold the most promise for transforming healthcare delivery and outcomes?
Look, I mean, let's start with the simple Gen AI, generative AI, because everybody's using it and it's within your capacity to look at. You know, partnering with ChatGPT or using some of the capabilities that Gemini has to build your own private instant for a quick conversational AI mechanism before you jump into artificial general intelligence AGI, or you go into machine learning. Start with whatever your capability will fathom. I'm talking about clinics and people down to earth. I'm not talking about the Cleveland clinics of the world where they have an R&D department that actually can get into an AI or enroll their sleeves down because they have the data, they have the talent, and they have the investment capability. So start small, conversational Gen AI. That is a model to start with. Start with the talent or two. Have a small data set that you can look at to start training your conversational AI model or chatbot. So try and, for example, look at customer experience, trends for canceling appointments. Let's look at a small use case using capability that you are at least you are within you. It's within your range when it comes to try to understand how AI models can be scaled up before you go big bang. Because you probably need to have a department, a dedicated governing body within your organization to look at AI. And I'm seeing already chief artificial intelligence officers being recruited in Dubai government to try and drive that AI strategy. So we are already seeing AI becoming engraved into the governance of organizations. I would follow the same pattern. If you are a clinic and you are able to try and have a small task force that would research the quickest way to deploy a conversational AI, whether it's to improve your patient experience, lower your no shows, or increase your claims approval process. Let's start with that, because that can be the smallest steps that makes the biggest impact. What is the 20%? What is the 80% headache that you can solve with the 20% steps? A couple of talents, a couple of data sets, and a use case that could allow you to implement within a Gen AI capability, whether using OpenAI or using Gemini or Google capability, or using local AI partners who are actually happy to do a POC, a proof of concept, with partners who are willing to deploy their resources just to get some sort of a proof of concept, right? I start with that before you go to the ML or computer visioning or AGI capabilities, because that's a lot of computing power.
Right, right, absolutely. Man, I feel like we could probably talk for another hour about all the different scenarios and aspects. And when you start thinking about, emergency room scenario versus a chronic care condition versus remote care, like there's so many applications for AI. But I just love the overall concept that you provided, but it was very clear and it was very focused. There wasn't a lot of fluff of, oh, what it's going to be in the future. It is here we are, here where we are today. Here's how you can implement. And yes, we are getting there, but this is what it's going to take, because it is a collective effort. It's not just a one person individual thing. It is going to require more for this to be a consistent technology that we see throughout various healthcare systems.
Absolutely. The use of AI in healthcare is a change of behavior. I mean, organizations like Cleveland Clinics, Mayo Clinics, John Hopkins, they're coming to AI from a mindset that they've built in the last 50, 60, 80, 90 years of research. And that's what makes a difference, right? When you come in with a mindset that is a long-term mindset where AI tools are not plug and play for the sake of making a quick commercial gain, you are actually utilizing the AI tool to lower your burnout, your workforce mental health distress, right? You're trying to increase your utilization and optimization of resources. When you come up with that mindset to tackle AI from a research perspective, a long-term perspective, that's when it makes sense for an industry like healthcare. Healthcare is a depth-driven industry, research-driven industry. If you are a clinic that wants to build a data hub that can actually then allow startups to come in and work with your data sandbox to allow them to test out and validate some AI models, I think you can create a wonderful ecosystem, knowing the fact that you have a clinical practice with amazing, robust, high quality data, anonymized for research with all the approvals that you need, and a good, talented workforce that allows you to host partnerships and collaborations and ecosystems that could actually bring in partners like Mohammed bin Zayed University, AI, or for example, TII, or research hubs that would allow you to segment those data sets and allow you to build AI models for the sake of looking at a strategy, a long-term strategy where the use cases could be fitting for the pain points that you're having. I think that would give more sense to a technology or a trend that not only provides you with a product, but the whole ecosystem of mindset.
I could not agree with you more. AI, implementation of AI is a change in behavior. That's that right there is the key thing to note. So, and we know that takes time. That's a
Absolutely.
process.
An industry like healthcare has moved from a product industry to a service industry back in many decades before us. And now we're moving into the experience and the convenience industry. To do that, that must make you an industry that utilizes research. We are like aviation, for example. If you look at an aviation, it's very simple. What is the product that you're offering and the convenience services that you're offering, and people would pay for that. But when it comes to healthcare, it's a life or death kind of business, right? And with that, you need to move into the emotional intelligence, the experience, the convenience part, because whatever you do when it comes to employing technologies like AI or solutions, AI-driven solutions, you need to make sure that you marry that with your research capabilities, because that will give you something that you will publish or you will celebrate if you succeed, and it will give you doomsday if you do not succeed and you cause human harm.
Absolutely. Absolutely. And I think that's a conversation for a whole other podcast for sure. So,
Absolutely.
Dr. Gadir, thank you so much for spending your time with us here today. I really, really appreciate it. We'll make sure that we add your LinkedIn and any other ways to connect with you and just follow you and hear more insights about AI in healthcare.
Absolutely. More than happy. Please follow me on LinkedIn. I'm maxed out on the first connections at the moment, but please follow me and there will be a great amount of interaction and let's connect. Absolutely. Let's collaborate further.
All right. And that's the final next see you guys next time on Vital Conversation.